Okay, so good to see you, Dr. Klim, and thank you for sharing knowledges and experiences to us. And also thank you for joining the virtual conference of Idea Forum, which is organized by Haas and the CAD. I'm Dr. Kim, and the Secretary in General of Korean Academy of Digitalized Dentistry. Nice to see you again. Okay, Dr.
It's good to
Klim.
be here.
Yeah, so would you like to say hi, greetings to the audiences and participants?
Yes, and hopefully my face will be up in just a moment, but it's a real honor and pleasure to be
Yeah.
part of the group here. My practice has been a joy for my career. I love education. I'm very humbled to be part of everybody else's. Um, there we go. I'm on now. So here we are. So
Okay, so
it's an honor to be part with you folks here, and I'm really excited about Amber Mill. I'm getting acquainted with it. I'm a real fan of materials, but I'm just a real fan of dentistry, and I love CAD CAM dentistry because we have control, and it's just getting better every year.
okay,
So
I agree with you. And we have a couple of questions from the participants, and also we have questions from the audience. Are you ready to go for the question and answer?
yes, yeah, we're
Okay,
ready.
so I'm gonna read some questions. I think you already read it from the chatting the screen, right?
Yeah, I did.
So this is
Yeah.
question from Yaoling Tang, and the first question was, you did biocopy from the mockup. Why not biocopy directly from the patient model?
That's
So
a really good question. For years, Biocopy has always been my go-to because I'm really big in setting up and planning, right? What's interesting is I work with other softwares as well. And when you do a digital wax up, we use templates. And so lately, what I've been trying to do, and I actually find I'm just about as fast on it, is, for instance, I'll use InLab, which is the InLab section of the Dentsply Frontis system, and I have different templates I can choose, and then I set them up within the Biocopy. Now, within InLab, that's actually faster for me to do than to finish the Biocopy. But there's different ways that I use the approach. I just did a case the other day, and I used Biocopy. But I'm moving out of that more because of some of the templates that we will have available to us in the software in the future.
okay,
Good
so
question, though.
okay,
Is there
so I understood. I understood that you use the biocopy as well, but sometimes not all the time, right? So that was
right?
the answer.
But I think the point that I was trying to make in this video is, no matter what I'm doing, I always want a Biocopy catalog. I may not use it for proposing, but I want it there because it's always a reference for me when I set my teeth up. And the approach I used today was using it as a reference to set the teeth up, using the link options to set up the arch and work through that flow.
Okay, so the biocopy is a reference point to start with, right? Okay, so second
Yeah.
question from Dr. Yaolin Tang is what's the minimal axial thickness, not the occlusal thickness. So what's the minimal axial thickness you set for the lithium disilicate?
That's a really good question. I've learned this from my friends in Italy. A lot of it depends on the function of the mouth. So the thickness for the axial depends on what I'm going to be cementing it to. For instance, I do a lot of conservative veneers. Uh, with that, I'll go down to 200 microns. The most important thing, if we're doing a crown, is still the occlusal clearance in the functional area, and I pay really close attention to staying in the guidelines of the manufacturer. But for the axial thickness, it depends. If it's a full crown like you saw today, those were about 0.8. I go about 0.7, 0.8. If I'm doing the veneers are usually 0.3 to 0.5, so 3 to 500 microns. Most of my veneers are in that range now, and lithium disilicate handles that very well. In fact, amber mill really mills well. It's a really nice milling material, and with that, I use the extra small burrs. So I have 4 engines, and then I use extra fine mill, and with that I call it a pressable mill. I can get really thin margins with no chipping.
Okay, so that's an excellent answer as well, and a good. Thank you for the good question and answer for good answers. Okay, we have a couple more questions here, and
Yeah.
I think we all agree that we're gonna need something before we grind before we grind patient teeth. So you said wax up, mock up, or prototype, whatever you call. I definitely agree
Right.
with you that we're gonna need prototype, right? So, but I
Right.
think it differs from situations, of course. But how long you recommend to use the prototype in patient mouth? So how long
Well,
you suggest to use the prototype in patient mouth?
well, I use prototypes several different ways. Like, for instance, most of my cases, like that very first video that I showed of that gentleman having emotional closure, that was an additive case. So I did not prep his teeth. That was a mock-up in his mouth. And I'd like to get emotional closure there unless I can't do that within the mouth. In other words, I can't enlarge the curvature of the smile. But usually in my practice, I have three different styles. One style is I may do the smile in the same day. So if that's the case, I'm going to go start to finish in the same day. My favorite, though, is to prep one day and put it in 2 or 3 days later. If I'm not doing a lot of soft tissue alterations, a lot of my clients like that turnaround rate. And then the third way I do that, I'll place them in transitionals, particularly if they're a full mouth case, and I may wait 2 or 3 weeks based on the demands of the case and my schedule. But one thing I love about CAD CAM, regardless, I want a mock-up, I want an emotional closure, but the mock-up guides me through the journey quickly and it gives me confidence, particularly if I'm doing it in the same day.
Okay, so your answer was you can do it in same day or 3 days, like two options. And also another option is about using a prototype for 2 to 3 weeks in case that you
Yeah.
need to change the video, right?
Right, and like if I do a lot of soft tissue manipulation, laser work, or I use several different lasers. I use the Irving YAG. I use diodes. If I'm doing a lot of soft tissue work, I like the soft tissues to heal. And another product that I use for healing and transition is, I didn't put it in the video here, is that Cervitic by Ivoclear, which is a varnish of chlorhexidine, and it really heals and keeps the soft tissues really nice for the final placement of the restorations. But I think we have really good products today that help that journey. But most of it to me is my time and also the condition of the soft tissue, because I want the soft tissues to really be in good shape when I'm placing them in. Yeah.
Okay, so I agree with you the importance of soft tissue before we make a final impression or final
soft
scan.
tissue is everything.
Okay,
Yeah.
so by the way, I think you're a very good dentist, but not a good person because you make the patient cry. Is it
Well,
usual to happen in your office after mock-up?
you know, it's interesting in my journey of dentistry, having done smile makeovers for 30 years. It's very humbling to do it, because sometimes you do your very best and maybe the patients don't have closure and they want it changed or something. So what I have found, and part of it is my wife is a psychologist, that if I can get the emotional closure before the final restorations, then they trust me more. But the question is, do a lot of people get emotional and some cry? Yeah.
Okay, so that's interesting that your wife is a psychiatrist, right? Okay, so we have a couple more
Yeah.
questions. Are you ready? Are you okay to go for it?
Yeah.
Okay,
Oh,
so
I'm having a great time. The only thing I wish I could be there with you folks.
okay, so wow. Have a question about the preparation sequence for the anteriors. The case
Yeah.
that you show us was you started the preparation from the lateral incisor, not from the number 8 and 9 to centrals. So you started with the lateral and canine first, then you leave the centrals at the end, right? But from my
Right.
point of view, so I usually start with number 8 and 9 to centrals because for me, it is important to control the thickness and preparation amount
Yeah.
from the two centers because the two centers are most important teeth for me, right? So it's like
Yeah.
a vice versa to prepare like a preparation sequence. So would you explain a little bit about advantage to leave number 8 and 9 two centrals at the end?
That's a really good comment because for years I always did the centrals first. I did, and I'm really creative. I don't know if it's right or wrong. It's just more of a personal preference. But the centrals for me are the centerpiece in the smile. Like for instance, if I can get the midline on, the smile's going to be great. If the centrals are the main actors in a show. So if I'm working through a mock-up, which those teeth had mock-up resins on them, except for that one crown, I find that, at least for me, the centrals are a reference in my preparation perspective. And I've been trying that more lately. Like, for instance, in this case, it's unique where I'll prep one side of the mouth, then I'll scan that in. And by the way, this
Wow,
patient
that's
would metabolize it.
that's a good idea too, right?
Yeah,
Okay.
but this patient metabolized anesthetic real quick.
Yeah, okay.
So that's kind of why I went in that motion, is where I kind of build a model as I go. But the main reason I didn't deal with the central first, because I didn't change the cant of the midline. Like if I'm changing the cant of the midline in the prep, then I'll probably address the central first. But as of late, in fact, I just prepped a case last week and I did the centrals last because they gave me good reference for the angles. As long as my centrals are on, like if my centrals are on, I use them as a reference, and even the way I angle my burrs as I go distally. It's just something new I'm trying. I don't know if it's right or wrong. Um, Maybe I just do it from getting bored, but I like the reference of the central and midline when I'm prepping the other teeth, because when I prep the other teeth, I know when I design, I want all the interproximals to have the same draw. So it's just something I've done since I've been doing a lot of my own ceramics. I don't know if that's a good answer. It's
Oh,
just
I
why I
think
do
that's
it.
a good answer. And if I have a chance to prepare the like multiple anteriors, I'm gonna consider that way to prepare the leaf number 8 and 9 to centrals later.
It's just something new I've been doing lately, and I find that I'm really visual. I am so visual that I'm just mixing it up to try to find new ways to make better templates, at least for me, and hopefully it will help someone else out. But
Okay, so anyway,
good.
the .16 chamfer is my favorite too, and I use the football shape
Yes.
for the lingual reduction.
Mhm.
Okay, so we have few more questions and about the characterizations. Are you do all by
Yeah.
yourself? And how do you think to compare the like characterization in design tool, and instead of doing one by all by yourself? And I think that takes a lot of time. And I think you have good efforts to put every single restoration, but I wonder how long it takes for the characterization for the single restorations.
Wait, you know what's interesting about that video? That was a technique video, and when you're videotaping it, it always takes a little longer. I like the natural features within the software to get the basic lobing down. It doesn't really handle the secondary depression that we see cervically. But even having said that, maybe it's more me. I'm on this quest in my career to master morphology and microtexturing. And like if you were to look at my portfolio book of my last 30 smiles, not one of them looks the same, because I kind of get a feel for people, and I determine, do I want more aggressive texture here? I'll even open up books. I'm a student. I just hope I never have to retire, because I'm a student to learn from others. In fact, when I was doing that case there, I actually had a book open on the side looking at another case that a mentor of mine did, and I'm going, well, I'm going to try this time. So I characterize, when I'm not videotaping, I'm probably a lot faster, but I mainly try to get the primary depressions So the reflective and deflective angles look the same, particularly the closer to the midline, the more picky I am about that. But what I really like is the tertiary texturing. That's the micro texturing that just really brings something home. And yeah, it does take some time. I kind of have a practice that I love doing my own ceramics. I've done my own ceramics for 20 years. It's been a lot better since I've had CAD CAM dentistry, but the beauty of ceramics and having good ceramics available to us is that it allows us to master our craft. And when we master our craft, that's how we keep our passions alive. So I know I'm rambling on here a little bit, but to me, it's all about passion. I'm so visual. I just love doing it. And if I'm doing a tooth and I'm not videotaping it, I'm pretty fast at it.
Okay, so I'm sure you'll be faster because you use it for more than 20 years, right? So that's the point
Well,
that I respect you about the effort that you put it, effort and passion that you put it in the restoration. Okay,
yeah, and I like new materials too because every material has a different
okay.
characterization to it, and I kind of brought that out. Yeah.
Okay, so of course you already talked about the material issue. So the next question is about the material. We have, we have hundreds of material out there in the market,
Yeah.
and when you, of course, we have to choose the zirconia, lithium disilicate, pathic porcelain in different situation, in different case.
Uh-huh.
Okay, so
Uh-huh.
you showed us about the case that you use a lithium disilicate. That's from the Haas, the amber mill, I'm sure, right?
Yeah.
So
Yeah. That case was there. Yeah.
yeah, how do you think the advantages of amber mill compared to other material, or why you choose the amber mill for that case? Okay, so we are
Well,
asking about the material selection.
to be honest with you, I'm I'm getting acquainted with amber mill. There's several things I like about it. I think the milling quality of it is really nice. It mills more like a microfelspathic.
Hmm.
Um, I'm still getting used to managing the translucency with using different heat programs on that. I think one thing that's interesting to me about ceramics, and I've always liked microfelspathic, is because of the fluorescence, right? And and for lithium bisilicate, this, from everything I've read and seen, this has really good fluorescence to it, and I think that's really critical in keeping teeth look vital. Now, the case I did there, I when I get, once he heals and everything, it's going to be interesting because things always tone in. And living in California, he wanted the W3, which is kind of bright. I like more natural looking teeth. A lot of my clients are Californians and they want the really white teeth, but
Okay.
I like really natural looks. And what I'm looking forward to is doing more cases with more natural colors. But I'm really cueing in on the fluorescence of materials. And what I think is unique about the amber mill is the fluorescence. And I'm learning. I'm a student. I'm a student
Okay, so
learning
very
this
old
new
student,
material.
not a newcomer, right? Okay,
No,
so I'm sure
I'm a student.
you use all the different materials from the all different companies, right? So
Hmm.
amber mill, from my point of view, it's a little harder material to mill. So like it depends on the milling machine. It's hard to control the.
What milling are you using? Like the 12 burr on the what milling size burrs are you using?
Well, I have to check it in my office. I cannot remember the name of the
Yeah,
machine, but the hardness of the material is good. That's a good point. But at the same
it is. Yeah, I
yes, it
interrupted you.
is.
I'm sorry.
Yeah, but the other side, it's hard to control on the machine sometimes, right?
Yeah,
If it's
well, what
harder.
I found, yeah, like for instance, when I texture in a microfelspathic, a lucite, a lithium disilicate, amber mill has a different feel than like Emax. Emax is really soft.
Softer.
Amber, but what I found in with amber mill is that I actually liked texturing it after it crystallized to put it in the final texture. I That was new for me because usually based on the ceramic, like I'll do that if you're using Impress, I've used Impress for years, which goes clear back to the early '90s, and that has a softer feel to it. So texturing is different. So I'm still learning, but what I really liked, and I'm using Mail now. I used to do a lot of cutbacks. I don't do a lot of cutbacks because I like a really strong incisal edge, but I'm using Mail on the incisal edges, and I didn't have enough time to show the video on that, of where I would just use the brush on ceramic on the incisal edge and then polish in the main body. And to me, that's absolutely gorgeous.
Okay, so thank you for the questions. Thank you for the answers. And we have like a couple more questions left. After mock-up, you do the prototype, right? So you said you leave it one day or same day or 3 days, or in the case that you need to change the vertical, that you can leave it. Depends on your schedule, of course. 2 to 3
Yeah,
weeks,
and
right?
and,
So
and
after
one thing I'm sorry, I didn't mean to interrupt you. I think it's the delay. Go ahead.
yeah. Okay, so after that you use a prototype, so when you copy the prototype to the left side, there are a couple of ways to do, right? So you can make
Right.
impression, or you can scan, or use as a reference before you go for the final design. All right, so which way you prefer? So you're using by impression and making model to the transfer to the lab as a duplicate, like a double scan data, or you
Yeah,
just do the
yeah.
intraoral scan data to
I
transfer to the lab?
I think I understand. I feel the mouth is the best articulator. So
Okay.
what I will do is that if I change the vertical dimension, I always change it in transition. I know there's studies to show that the joint can take 3 to 8 months to remodel, and I always use a CBCT to see if there's arthritis there, and if they've had a lot of remodeling, I know they're going to have more remodeling. So I want them stabilized in that period of time. So that's where I use transitionals. So when I go to comprehensive care, I will do the mouth in sections so I never lose the vertical, and then I make that more into general dentistry again. So I do use models though. This model happened to be a stone model. I usually use a printed model, and I use the a Sega printer for that. That's really accurate.
Okay, so that's clear.
But yeah, but I don't use a lab bench to set my occlusion up.
Mhm.
I believe, particularly with the prime scan, it is so accurate that I set my occlusion up totally from what I scan in the mouth.
Okay, so
And,
you
and
never design to open the video in the lab, and you check it in patient mouth and you copy
right,
it.
right.
Yeah. Okay,
Well,
that's a good
I don't
point.
want to go down this rabbit hole, but there's some studies done by Javier Vasquez from Florida that shows that if you open on an articulator, unless there are joints in a good position, it will distalize the joint. Because
Okay.
we're doing jaw tracking using 3D now, which is really interesting, and that's why I love this technology so much, because I'm using jaw tracking with 3D. Everything's digital, so
Okay.
I'm managing everything from the mouth, and I don't. The only reason I have a model is just to finish on, but I don't. I finish my occlusion from the scans that I take from the mouth.
Okay, so that's an excellent explanation about the occlusion we need to change. Okay, so I believe you're in the middle of during the weekend, and thank you again to have you during the busy weekend. And
Yeah.
I don't think I can say thank you enough to you to joining us. And Dr. Klim, I have the appreciation plaque on my
I
hand.
love it.
And would you like to come over and take it?
I would like to. I'd love to put my hand through the screen
Okay.
and take it from you
Okay, so
folks.
I'm sure the Haas will send you the CEO of the Haas. Would you
Mhm.
Mr. Kim will send you through the online. Okay, I'm sure they will send you through the FedEx.
I love
Okay.
it. And I've hi, how are you?
Very good. Thank you for
It's
your
good to
great
see you.
lecture and very good answers. I will send you this flag by courier
Yeah,
service very
I
soon.
like that because I look really young in that picture.
Okay. So thank you, Dr. Kim.
Thank you.
Bye bye now. Thank you. Thank you for having me. I appreciate it.
Okay, have a great weekend.
Okay, you
Yep.
be safe now.
Okay, bye bye.